It's now my privilege to just offer some closing reflections, and I'm not even sure how you do that. I think we've all had a very, very rich day. I think we started off, I think Dr. Sao is still here somewhere, maybe? He might now have left. Yeah, he had family to go to. But he started us off this morning really talking about looking deeply at a situation and considering the needs and realizing, because of his own journey, what the needs were to prepare families, to help them be accessible resources that would help them understand the journey that they were on and really lean into sort of what was happening and to ask the questions that they may not have been able to ask when he was there, when his family were going through this, but that would help many others. And just the ripple effects of that, he now has a globally recognized podcast. So accessible, actionable resources that many of us throughout the day, I've heard of some of the initiatives that all of you are doing to provide these kinds of resources, to provide educational materials that are informative and actionable and that meet the needs, that help patients and families navigate, to advocate for them and to honor the journeys that they are on. And I think we heard from Kelly, who talked about we need to do that for everyone who's going through this journey, not just the people who have traditional access based on privilege and maybe socioeconomic factors, but for everyone, people living on the streets, the patients with substance use disorders, the patients living in rural and remote communities, the people who face challenges based on their diagnosis or their condition, which is so rare that resources may not exist where they live or where they find themselves. So I think that challenge is a sense of, we were encouraged to zoom out, to not just look at our specific situation where we are potentially making a difference with the work that we do, but also to consider more broadly. And I just thought about the who, what, where, et cetera. So we started with a focus on patients and families facing a serious illness, looking for resources that would help them navigate. But then we were encouraged to ask the question, who's missing? Who's not part of the team, who's not receiving this care, and how do we customize it? How do we create equity, safety for them? How do we do that in a way that makes sense, that's based on their needs, that's patient, family, human-centered? And where? Everywhere. When they need it. What? And I just kept being reminded, and I don't know if it's a theme I just heard, but I'm sure all of us, is that it came from when we were able to listen deeply to needs and take the time. And I was talking to someone at lunch who said, what physicians often don't realize is that they're so focused on time that they work harder but not smarter. That taking the time at the beginning, taking the time throughout the journey will actually save us time later on, and it creates sustainable change, not just for that person, but it also changes us in a way that then we're more equipped to meet the next person's needs. So I think just this heart that continues to hear and to be curious, to approach each new situation with questions that really help us know, who is this person? What is this family? What is their family of choice? Who are the people they want to be around them? What would be meaningful for them in this journey, and what would a good death look like for them? And in that, I felt like this theme of hope kept coming up. I think for us, any of us, to be involved in this work, we have to have a belief that what we do makes a difference. And that took us back, I think, to the sort of theme of the day. And I just had some different sentences that I heard from different people that just resonated for me. Engagement takes time. It takes dialogue in which you change your agenda based on what you've heard. It takes co-creation, which creates buy-in. In the concurrent sessions, this focus on health equity, access, quality, safety for those with neurodevelopmental complexities and intellectual disabilities, for structural vulnerabilities, those with specific diseases or conditions, those who live in rural, remote, or ethnic communities, those who live in Indigenous communities, children and families, and learning about ways not just to get them through the specific incident, but ways to promote healing, wholeness, health for those who suffer complex grief, compound grief, repeated losses over time through the toxic drug crisis and other factors. And so this idea of compassionate communities just expanding in our understanding and our ways what that might look like. So now what? How do we take what we've heard and translate it into effective action? By next Tuesday, what is one thing you could do differently? I said I would ask, so here we are. And I just want you to think about it. It may be something you heard today would be a change work-related, but it could also be a personal thing. I'm going to get more informed. I'm going to get, there's some things I don't have language for that I may explore in a different way. I may choose to use my privilege in new ways, just using some of the language that we heard. Or in your community. Some of us, I know somebody went away from one of our talks and created an initiative in their apartment building with their strata to provide meals for people, to provide rides for people. He was a physician, but his opportunity lay in his building, not in his work. So just to think about that. What can you do differently, and what is one commitment you'll make to do something differently over this next week or over these next few days? How will you go home and share what happened for you today? What will be your takeaway? What will you say? Well, it was a good day, and then if somebody wants to know more, not everyone does, what will you say? And I just challenge you maybe just to turn to one person next to you at your table. We don't want to erupt into general conversations, but just turn to one other person and say, what I'm thinking I might do is, and then listen while the other person shares what they might do. So just take a few minutes for that.